So before I started medical school where I grew up, I worked with a variety of really vulnerable individuals who were being passed from service to service. They were falling through the gaps, people who were just not getting the support that they needed. I think there's a really clear mandate in the Bible for us as Christians to be coming alongside and loving and supporting the poor and the vulnerable. And I think there's so many amazing opportunities to do that as a Christian doctor. We're not here to just treat the medical problem, but we're actually here to see those patients the way God sees them and to love them the way Jesus would love them. I think generally there's a lot of inequality in healthcare. There's a lot of groups who are marginalised and put aside. They're seen as difficult patients. They're seen as a problem rather than people who are vulnerable, people who haven't had the same opportunities as you or I. And actually they need good doctors. They need people to come alongside and advocate for them, to support them and give them the time and the resources that they need to thrive. I think that's quite a common misconception in healthcare and something I'm quite excited about trying to address a bit more. One of the things I've really valued about CMF is the personal relationships that come alongside it. And so outside of my day job, I run a charity supporting vulnerable groups, and the support I've had from individuals in CMF who've helped me think through problems and really take that to the next level, to go and start having those discussions with our local council, for example, on how we better support the vulnerable groups in our community, how we can fight for them a bit further upstream by fixing some of the more systemic injustices that affect many of our patients. Having some people alongside you who can impart wisdom, bring experience, encourage you, stand alongside you in prayer, there's just something incredible about the relationships that you build as part of CMF. But also, that's when God's moving, that's when doors start to open, when you start to find opportunities. I'm doing the job I'm doing now because of a connection I made through CMF. It's like one big family. I've been able to be part of quite a few of the courses that CMF have run. I was part of the Health and Justice track, which was an incredible equipping opportunity, learning how to really pull apart the theology of biblical justice, but also the practical application of how do I support individuals who are asylum seekers? How do I support those who are homeless or struggling with their mental health? I think if I hadn't been part of CMF, I would have missed out on so many opportunities, mainly to just meet incredible people who have encouraged me and inspired me and equipped me. But also, I think I've become a better doctor because of it. Not only in providing care for my patients, but also being able to live out my faith in my workplace and truly be myself.